What's up guys, welcome to another video. Emily, your Meta Skin Fairy here, and today we're really going to jump into tips, tricks, and recommendations for your upper face. So we're really focusing on the eyes, especially with wearing a mask. Usually that's the first thing that we look at. So listen up, because these tips are really for you if you are concerned with your upper face. Now, full disclaimer before we begin, all the recommendations that I do give, obviously take it with a grain of salt. Don't, think that it's gonna fix all of your issues. These are just regular questions that I do get on a regular basis. So I just thought making a video about this would just be easier so you guys can have a reference point. And if you have further questions, check with us, send us a message at Meta Esthétique on all the social platforms. We're always happy to answer your questions. Now let's begin. So number one, very popular these days, having really long and healthy lashes, right? So some people may like to have the extensions, which is totally fine. You have that dramatic look, which is really beautiful, but others prefer to have a more natural approach to it. And this is why I recommend using a lash boosting serum. So I am a perfect example. My lashes, if you've seen anything on our social, my lashes are really long, and it's because I use a lash conditioner product that boosts the growth of my lashes. And no, I don't have long lashes like this usually. So the way it works is that it's packed with vitamins and peptides, and it really boosts the circulation and the growth of your lashes. And you can even use it on your eyebrows. So if you have a hole in your eyebrows, you can totally use it on your eyebrows. So I think it is a great product to consider, especially if you want to oomph up that look area with longer lashes, but natural looking lashes. Now, when you use it once a day, and you should start seeing growth within 4 to 6 weeks. So it works pretty quickly. You may want to know the difference between a product like this compared to Latisse, which is the prescribed version of a lash grower. So that's basically just it. Latisse is really strong, and you need a prescription for it to get the medication, and it is much stronger. So if a lash boosting serum doesn't work for you, then you know that your next step would be Latisse. But I do always recommend to start with the other one first, because it's more budget friendly, and if it works for you, then it's awesome, right? Number two is to really give some tender loving care to that eye contour area. So if you look at yourself in the mirror and you see that skin being really dry, and you're starting to notice more fine lines. And the thing is, when we wear masks, sometimes I see this all the time. People have their mask so tight on their face that it actually brings the cheek skin up, and it creates creases in the skin, which is not good, because accumulated usage of having your cheeks like this, you're gonna have little lines that are gonna start to stay there over time. So what I do recommend is that focus on your eye contour and get a quality eye cream. Now, I know some people apply their moisturizer on their eye contour, but I don't really recommend that, because the ingredients that you will find in your face moisturizer will not target the delicate, sensitive, and oil-less, if I can say so, contour of your eyes. So your eyes are more sensitive. There's less oil glands in there, so it tends to be drier. And the ingredients that will target your face will not be the same ones you will see in an eye cream. Your eyes really need specific kinds of ingredients to target that sensitive skin around your eyes. So for example, caffeine is one of the most common one you will see, because it tackles puffiness. Your face won't be puffy, your eyes will be. So that's the main difference between an eye cream and a face moisturizer. Now, another thing that you may consider if you're already using an eye cream and you want an extra oomph, do a professional eye collagen treatment. So we have one here, and it's from Swissline, and is 92% pure collagen. And the difference with that collagen compared to other types of collagen, it's not marine collagen, it's bovine collagen. So it is the closest one you will find to ours within our skin. And that collagen is actually medical grade, and it is actually used. They did clinical trial and clinical studies for such a long time, and this type of collagen is actually used on soldiers to repair their skin. So it's strong collagen. I will put a before and after right here so you can see the difference, but just in one treatment. But the results are amazing. So if you want to treat yourself to an eye treatment, definitely check it out in our website, because we have this awesome new eye treatment that's coming up in April. And if you want to give your eye treatment, your eye contour a little TLC, this treatment is definitely for you. Now, the third recommendation I have, I'm gonna be super honest and super open about it, because I do feel like nowadays women are more honest with the types of things that they get done, and they're more open about it, right? They talk about it with their girlfriends. They're not afraid to say, ooh, I got this done, look at my skin, it's amazing. I think that before having procedures and, even just like treatments, women were a little bit more like hush hush about it. And now, today, I think it's an open thing to be preventive with your skin and to age gracefully. So people are more open to talking about it, right? So the third thing I'm gonna recommend is having neuromodulators on your forehead. Hold on, don't judge me. It's because I have clients that ask me this question all the time, and we offer this service as well. So yes, it is a way to open your forehead a little bit and to prevent having deeper wrinkles in the long run. And just to compare fillers and neuromodulators, we're talking about neuromodulators here. So Botox, Dysport, those are the brand names. What they're going to do is that they're going to freeze the muscle from moving. That's it. It's not going to fill anything. A filler will fill a gap. So if you have really strong marionette lines, they're going to put filler there to, have a little bit more of a fuller look. But that's not what I'm talking about. I'm talking about neuromodulators, and they've been used for many, many years, and they work really well, because if you want to have a preventive approach to your skin and not have so many forehead lines in the future, neuromodulators would be your option. And the only reason why I'm saying this is because you want to know your options. And as a beauty professional, a skin therapist, I need to know the options that are available for my clients. So I don't think there should be any judgment in that. If you want to get Botox, go ahead. It's no big deal. If you don't and you prefer to do the natural way, fine, it's totally fine. But I don't want any judgment on this. Some people are more, pro to it than others, and that's totally fine. But if it can give you that oomph that you're looking for, go for it. Now, the thing I will say about injections is that they do not work on the quality of your skin. So if you expect an injection to fix the texture of your skin, the roughness of your skin, the overall brightness of your skin, then no, injections will not do that. Injections have really a single purpose, which is either to freeze your muscles so they don't move anymore, so you don't do the lines, or to fill an empty gap. That's it. That's why I do like to work in combination with injections if needed. If we do, we've worked on the quality of the skin of our patient, and her skin is beautiful, but they still need that little, this little 11 here bothers them, get a little bit of Botox, it's gonna stop it, and then she'll be completely, she'll be super happy. But I gotta give you your options. If you ask me directly the question, yeah, I'll tell you that it is an option, and you don't have to do it if you're not comfortable with it. But I'm just being super honest, and that's just how I am. If you want to get Botox, just get it. It's fine. We're not going to judge you. We got to be more open, guys. We do these things for ourselves, for our self-care. Who's with me? Anyone? Now, I hope this video gave you a little bit more insight, a little bit more tips on how you can oomph up your SMIZE game. We're going to focus on that next month. And I really do recommend that you try that collagen treatment around the eyes. It's amazing on the skin. The skin is beautiful afterwards. So I hope you guys enjoyed. Again, thank you so much for watching, and don't forget to subscribe. It really helps us when we see that people love the stuff that we post and commenting. So please engage with us. We love it when you do. And until next time, we'll talk soon.